Good morning, everybody, and welcome to Health Talk. I am your host, Dr. Niru Prasad, with my background in pediatrics, emergency medicine, and urgent care. Affiliated with Henry Ford Health System, St. Joe, Oakland, and Beaumont. The theme of our health talk today is early diagnosis of children with autistic spectrum disorder. Joining us today as our guest speaker is Jaya Priyadarshini. She is a board member of Child Development Organization in Ann Arbor, and we are very privileged to have her since she has so much experiences with dealing with all these children. So, good morning, Jaya, and welcome to my show.
Good morning, Dr. Prasad. That's very sweet of you, and I love to call you Niru Auntie.
Of course, you can do Niru Auntie anytime.
Yes.
So, first of all, you have such an extensive CV. I read through gears. So, tell our viewers what you are doing and all those.
Yes, my name is Jaya Priyadarshini. I live in Ann Arbor, and I have lived there for 25 years.
Okay.
And I have 3 kids of my own who are grown up now to be in college, middle school, and high school. So when the kids were growing up, I got very much involved with the school system and worked a lot on child development issues. Also went on to become a board member of some organizations that have worked in this area. And later on, I worked in human resources with the banking industry. So that helped because my experiences with dealing with issues and problems have helped me tackle business world in a really good way. And I also am a business owner where I focus, my business is focused on healthy eating of students and children because health is wealth to me.
Great. That is very important, healthy eating for our kids. We were all doing that, right?
Absolutely.
So now you tell us, what are the highlights of autism spectrum disorder?
Yes. So one of the biggest things that I would like to mention is that a lot of awareness has come about this topic.
Okay.
And first of all, for me, and I would say over the years, extended years, I can see that now it has a name called autism, which is considered as a disorder. A lot of things used to be just called as underdevelopment. It is not underdevelopment.
No.
It's a disorder.
Right.
And I have studied genetic engineering, and I did my master's in it. So I kind of understand how genes affect this.
Exactly.
And a lot of awareness needs to come still. But the biggest thing is that people have to understand that there is problem, disorder, error, whichever way you want to name it, at a chromosomal level,
exactly,
at the brain level. A lot of factors that are going into contributing to this are nowadays also environment related.
Yes.
And what I have seen is definitely a lot of research has gone into it, and it is helping. Definitely, it's a very cultural thing where people, even if they know that there is a problem, they don't want to be aware about it. They don't want to talk about it. But understanding of how things can be tackled, how things can be focused, early intervention, detection can, in a lot of cases, fix the problem. Give the individual a life they deserve. Be independent. And things like that.
So, Jaya, being in pediatrics and emergency medicine, I have seen a lot of those kids. Before, we kind of ignored them. But then, I did a lot of research reading and all those. And then I went through the anatomy of the brain and all those. So my next podcast will be about this. Wonderful. So if you have time, you can see my podcast. And basically what I found out, these chromosomes disorders, those the bad chromosomes, they go and affect the cortex of the little kids.
Yes.
And the diagnosis can be made as from age 6 months onward. American Academy of Pediatrics, they have developed a tool, and that I haven't had time to go into details, but I will share it with you. So what are so early detection mechanism? Can you focus on those?
Yes. The earliest detection mechanism that can be followed is by being alert.
Right, yeah.
Being alert, because prevention is always better than cure. That's a motto I have always believed in.
Yes.
And be very watchful with the kids. When they're infants, the mothers, the father, the siblings, depending on their age,
right,
the caretakers, they have to see those little early signs.
Yeah.
Children are very reflective.
Exactly.
If they have any problems and issues, they might not be able to talk, but they reflect it through their actions.
Sure.
So if this is realized earlier, people should not hesitate in getting...
Go ahead. Sorry.
No, that's okay. People should not hesitate in reaching out to the right people.
Right, yeah.
Go to the doctor. Talk about it. Don't think that it is a social taboo.
Right.
And that is where the biggest problem comes, is where the mothers, especially the mothers, they're like, no, my child doesn't have a problem.
Right. Or the caretakers.
Yeah, or the caretakers. More than the caretakers, even if the caretakers come and tell the mother.
Yeah.
Denial is a very big factor. And I understand. I'm a mother. I want my children to be perfect.
I know.
But the thing is, like, if there is an issue, the earlier you get onto it, the better you get it fixed.
Right.
So that is very important. Get the right tools to it. Focus. Children are our biggest assets. That is something the world has to realize.
Exactly.
We focus so much on other assets that we build in our lives. And they're all important. I don't disagree.
No.
But children are very important because we have created them.
Right. Yeah.
So their well-being has to be our focus.
Very important. The foundation, they are our foundation. And we see, though the earliest symptoms as a pediatrician, I remember a kid, 6 months old, no eye contact.
Yes. So
that's
some
one of the easiest things that I can think about.
No,
from
that's
my
true.
Pediatrics experience.
Absolutely. No eye contact.
Right.
Not responding when the name is being called out.
Right.
Not making eye contact, not just with you, but
with
also with other motions and sensory things that are brought into the children's era. Yeah. And as they grow, then there are more symptoms that become evident. They don't smile that much.
No smile.
No smiles. Very much having at moments a blank face.
Yeah.
Being withdrawn and sitting on the side.
That loud noise.
Exactly.
Yeah.
Loud noise can't be tolerated. They don't want to interact with people.
Right.
Some of the things that can be very interesting for other children are not interesting for them. Just playing with a simple toy.
Right.
Interacting with an interactive toy.
Right.
So those are things that we need to watch for.
Yeah.
How is the child doing? So these are symptoms that happen in very early childhood.
Yes, right.
And but then there are other things as we grow. And what has been found in recent research is that autism-related symptoms not just occur in early childhood, but they keep happening all through the growing era.
Exactly. This is a very interesting point, from my research study. It can even happen in a normal born individual, and with all those chromosomes, trisomy, all those things molded, there is mutation.
Yes.
So
on that point is that we don't know when our genetic system is going to be affected.
Exactly.
We don't know. Someone who's born very normal, had everything, will have some symptoms that are coming when they're in the adulthood.
Right.
So the chromosomes, as far as I know and we all know, go through a process called mutations.
Yeah.
And those mutations, which technically mutation is a medical word, a scientific word,
Yeah.
it means changes. Mutation means change. And if the change is negative, which can also be caused sometimes by environmental factors, which can be caused on your diet, what things you are consuming, pollution, and things like that. So later in life, as individuals grow, they also start showing those symptoms. And a lot of it can also be related in the present world. We call it mental health issues, mental illness. They are at times very interlinked to me.
So Jaya, now you tell me now, since you are with the school board, okay. So what is the role of the parents, with the teachers, and the role of the mental behavioral services when we send them to the pediatrician, as a pediatrician, we have those two tools, we detect. And if they don't fit in, our score is low, we send it to the behavioral services. Now you tell me, because you have such a good experience with the school system, what are the tools that a school system is using these days?
The schools have become very alert. They have opened a lot to this. A lot of investments has been put through the school systems into this. What I have realized over the years is that people are more communicative about it. They have become communicative about it. Parents, if they have known that their child is diagnosed with this, they are coming forward and they are asking the school system of where they can get the right tools and the help. They are no more living under the shadow. Which I would say 15 years ago, I saw very few parents coming up with these issues.
They used to deny. If you tell them, they used
to feel bad and denial, but no, because now people are understanding that as any other part of the body can have an issue, can have a health condition, so can your brain.
Of course.
It's also, you are a doctor, so you would know it's a body organ. So if a liver and a pancreas can get that, so can that. So that is happening. Schools have put in a lot of effort. There are a lot of programs for speech therapy for children, for communication for the children. And I know very closely a few friends of mine who brought their children with these issues. And today, these kids have gone out in the society and they're doing a great job. Very important is to hire the right people to do this job.
Exactly.
So schools
people should have a lot of
patience.
Yeah, you know what? That's very important.
Very important. A lot of love and care.
Yes.
Because these children, they will follow you. They will do everything, but it has to be done with love. They do understand the language of love. That's what I have realized. So that is happening. So a very good communication between the school and the parents is working. They have opened different modules where if parents don't feel very comfortable in coming up, they can do it through an app, they can do it through an email, so that things are like, we also have to understand and respect the cultural differences that we live with. So schools nowadays have become very, very absorbing about that part. So that is a very good development that I have seen.
So the school health system that you are involved with, they have all sorts of modules and they have a lot. But what I'm going to ask you next question, this is good in our country, but what about the third world countries, because they are suffering. How could we help the third world countries?
Yes.
That's very important, because here fortunately, we are privileged.
Absolutely.
How can we help the third world countries?
Absolutely. This is a very good topic, Dr. Prasad. You did a great job by bringing this up. This is amazing. We owe to the community and the society that we live in. And as every individual, we don't have to be very, very successful to contribute for this. And we are very privileged that United States has put in a lot of funds into the research for this disorder, problem, and in a lot of ways, it is conquered. There is a lot of work still to be done, but resources come out to a lot of families. They're able to get it. The developing countries, some developed countries, some third world countries, as we can say, because based on their resources and things, because I believe that every society is very progressive, and they want to reach out certain level. But the biggest thing what we can do here is that if we have resources, if we have the feeling and the tools. Exactly.
Very important.
And we can create the tools.
Yes.
If we have the passion for something, we can create the tools and reach it out and take it out to those people over there. And I'm going to say a few words here, which is you are a living example of what you have done towards this cause. I visited a center in my home state, in my home country, in India, in Bihar, in the city of Patna. And I was amazed to see the amount of work, the effort that you have put into this organization that works and focuses towards children with autism spectrum disorder. We need more and more people to come out. We need more and more people to think beyond our own boundaries.
Exactly.
We need to be inspired. And that is why your story is something that needs to be put out there too. Because you have lived here, some 50-some years?
50 years.
50-some years. But your commitment towards this. And it's not, people say, I don't have time. No, we can take time out. We can. Definitely.
Always to find time.
Always to find time. Today is the digital world. The whole world is a global village. We are connected. Whatever help we want to send, we can send. So why not? Let us come out, find out organizations. Every country has a small or a big organization working on this cause. Get attached to them.
And help them.
Give them the encouragement, make them feel that we are hearing. A country as affluent as the United States, as rich in research as we are, we have to give the message out that we are there for you.
So Jaya, my motivations, I always tell my children also, you develop a passion up there. What you want to do doesn't have to be a doctor. You can be an engineer, teacher, and then you motivate yourself, towards that, achieving, and then you follow the pathway, how you do that. And ever since I was very early age, 13 years, we used to pass through the orphanage and all that, and it stuck to my brain. My father said, the only way you can help, you become a doctor. Always stick like a hammer, and I followed my passion to the motivation after, child raising 4 kids, husband, children, grandchildren, and then I focused myself to this. I authored 2 books, and the first book was donated to the Blind Chair Foundation.
Amazing.
That proceeds were all gone there. I was inducted to Hall of Fame by the Orphan Medical Network.
Wonderful.
And they took my book personally to the Calcutta Orphanage. The second book that I authored, during COVID era, because I could not work, 100% profits are being donated to the UNICEF Foundation.
Yes, absolutely. So as you said,
this is a motivation for our children.
Exactly. So parents have to play a big role. We have to keep our children known about the fact of how important the community and the society is. We see a lot of parents, and including me, I would not take myself out, but like, okay, you have to do good in your studies, you have to do this. Yes, but there also has to be a focus where you want your child to become a good human being.
Focus, right.
So if you become a good human being, you will be encouraged yourself
Sure.
to have a passion to help people out.
Understand the moral values of life, right?
Very important. It is very, very
For
important.
the kids, yeah.
Yes.
Helping others,
Yes.
volunteer, whichever way they can.
Whichever the way they can. If they get this
It
thing
is-
of giving back, helping and working, then every cause in the world is good enough for their
Right.
participation.
That is true. That was the message. I raised 4 kids. We have 8 grandkids.
I've seen the beautiful family you
I
have.
know, and then
It's amazing.
Good moral values
Exactly.
in life. Yeah.
Exactly.
So that's very important, and I'm so proud of you. You are doing the young generation, comparison, you're doing so much for the community.
Yes, and also, it's like we can't just sit and write on paper that let's make the world a better place.
Right.
We have
cannot
to
do-
step up and do it.
Exactly.
And no matter where we are, I have lived in the United States for 25 years.
Yeah.
And I have found a lot of love here. And it's my duty to give that love back.
Exactly.
And I've told my children work a lot with senior citizens.
Yeah.
They volunteer at a lot of organizations, rehab centers.
Yeah.
And it is not because you want to do it, you should to do it.
Right, yeah. Give out what God
You
has.
have to.
That is true, right. So what is your next mission going to be now, Jaya? You are so full of it.
I'm working very closely with the rehabilitation center in my home state.
Okay.
And I'm going to be there on December 3rd to celebrate World Disabilities Day.
Yeah, that is a World Disability.
Yes, well, and we are, and that is a center where you contribute so much.
Right, yes.
And I have been able to get some associations in Michigan, which is one of them is our Michigan Bihar Association to work.
Right, yeah.
To work with them closely so we can have the funds, right tools over there.
Yeah.
And so one step at a time, but definitely working towards that goal. My other goal right now is working with some senior citizens in my community.
Yeah, I was going to ask you about that too, the
Yes.
senior citizen
Senior citizens.
health safety.
Yes. So working on that because with COVID, one of the challenges that they have faced is not having people to communicate to.
Right.
And that has shut people down.
They are
so I'm
lonely.
trying to,
Yeah.
they're very lonely. And so I'm trying to get them to be open up, have groups, have friends,
Yeah.
have Zoom meetings once a week where they can just sit and talk, look at faces.
Right, yeah.
And you know what? I would say my biggest goal in life is to see a smile on every face.
Yeah, that is very important. Laughter is the best medicine.
Yes.
When you smile, then people don't see wrinkles on your face.
Exactly. There you go. So here I am talking to a doctor who knows all the ins and outs of anatomy. So, no, that is great. And so that is my big goal right now. That's what I'm working towards. I also run a business which I focus on healthy eating.
Right.
There was a reason I started this business was because as we talked about environmental factors making an impact on the ASD,
Right.
so is also a lot of food that is used with preservatives and chemicals. I'm not out there to lash anyone,
Right.
but if we can avoid it, we should. So nutritional, good organic eating, early in life is important to
Very
set up our
important.
goals.
Early during the growing periods of a child.
Yes. So based on that focus, I started this business, which also focuses on zero waste. Because we are putting too much pressure on the environment.
Yes.
So let's not do it. Throwing away food is not a good thing.
No.
So I put all those things and launched this
Wow,
business.
you are a wonderful person. I call you a Wonder Woman.
Thank you so much. It's been 6 years. But to all my
How
viewers
long
out there.
You've been doing that for 6 years. Oh, okay.
So to all my viewers, here is my inspiration. I get inspired by her. So
Yeah, that is very good because nowadays, so much of chemicals. So basically, do you favor the organic grown foods?
depends on how it is done.
Yeah.
So because with the concept of organic, if you just go literally, is by use of no carbon. That's
Right.
now how it is. You also have to focus on having things that are grown in a non-genetically modified environment.
Yeah, okay.
So you can use a non-genetically modified seed, but what if you're using pesticides and too many chemicals?
Right.
So that is going to cause the mutation there.
Yeah.
So the benefit is lost. So be careful on what you are eating. Eat healthy. Focus on a good lifestyle.
Right.
A very balanced lifestyle. And
Right,
food
yeah.
alone is not a lifestyle.
Right.
Lifestyle is also about being happy.
A better life is.
Yeah, interactive,
Yeah.
helping each other. And if we bring in all the factors, life is a big picture and it all comes perfect.
Good. So the last minute, what advice give to our viewers who has been watching your show last 1 minute? Keynote advice.
A very important thing. I'm not a preacher. I'm not someone with huge authority. But being a simple human being, I can tell to all people: stay happy, spread happiness,
Yeah.
be very, very positive. Science and life go very close together. What energy you send in the universe is what comes back to you.
Exactly.
So if you send out positive energy, that's what you get it back. And just not, if you meet someone who's negative and is trying to ruin your day, just sometimes try to
Forget
understand.
about them,
Yeah,
right?
try to see where they are coming from.
Exactly.
Giving benefit of doubt in life is very important to me.
It's very important. And I'm adding the last
Yes.
one: calm, cool, and collective.
Exactly.
Remember 3C.
Absolutely. C3, CQ.
3C: calm,
CQ.
cool, and collective.
Collective.
Yeah.
So this is what I have believed in. It's been my mantra of
Good,
life,
yeah.
and so this is what it is. And from the depth of my heart, I thank you very much for
Thank
giving me this
Yeah.
opportunity.
So, Jaya, I'd like to thank you so much for coming to my. I'm privileged to have you, young, energetic person like you. I'd like to thank our viewers for watching me on my health talk. The title was Early Diagnosis of Children with Autism Spectrum Disorder with our guest speaker, Jaya Priyadarshini, who is a board member of Child Developing Organization in Ann Arbor. And I like to thank our producer for helping me create this health talk. And until I see you again, have all of you, I wish you a happy fall and winter. Thank you again.